Today's medical-centric topic is vaccine hesitancy and the resurgence of measles and mumps in adults. Why measles and mumps are reappearing. Measles and mumps were once considered childhood diseases largely controlled by vaccination. However, recent years have seen outbreaks among adults, driven mainly by vaccine hesitancy, missed childhood doses, and waning immunity. These outbreaks highlight gaps in population-level protection. Understanding vaccine hesitancy. Vaccine hesitancy refers to delayed acceptance or refusal of vaccines despite availability. Common reasons include misinformation about safety, distrust in healthcare systems, belief that diseases are no longer a threat, and confusion around vaccine schedules. Social media has amplified myths faster than corrective information. Why adults are now at risk. Many adults assume they are fully protected, but that is not always true. Some never received 2 doses of the MMR vaccine. Others were vaccinated during periods when schedules differed, and immunity, especially against mumps, can decline over time. International travel and close contact settings increase exposure risk. Measles in adults, more severe than expected. Measles is highly contagious and spreads through airborne droplets. In adults, it often causes more severe illness than in children, including pneumonia, hepatitis, encephalitis, and hospitalization. One infected person can spread measles to up to 90% of unvaccinated contacts. Mumps, not just swollen glands. Mumps outbreaks in adults are increasingly reported, particularly in colleges, workplaces, and military settings. Complications include orchitis, orchitis, meningitis, hearing loss, and infertility concerns. Waning immunity plays a major role in adult outbreaks. Herd immunity breakdown. Measles requires around 95% vaccination coverage to prevent outbreaks. Even small declines in coverage allow the virus to spread rapidly. Clusters of unvaccinated individuals create pockets where outbreaks can ignite and spill into the broader community. The role of misinformation. False claims linking vaccines to autism or chronic illness persist despite being repeatedly disproven. These narratives undermine trust and lead to preventable disease resurgence. Adults exposed to misinformation may choose not to vaccinate themselves or their children. Who should consider vaccination or boosters? Adults without documented 2-dose MMR vaccination, those born during transition periods in immunization schedules, healthcare workers, travelers, and people in outbreak settings should review their immunity status. Booster doses may be recommended during outbreaks. Public health consequences. Outbreaks strain healthcare systems, require costly contact tracing, and put vulnerable populations, such as infants and immunocompromised individuals, at risk. Clinical takeaway. Measles and mumps are resurging not because vaccines failed, but because vaccination coverage declined. Vaccine hesitancy has real consequences in adults. Reviewing immunity status and maintaining high vaccination rates remains essential to prevent outbreaks of diseases that are entirely preventable.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.